Hi, I'm Raghunath, pediatric intensivist and in charge of pediatric services at Sagar Hospitals, Bangalore. Today I'll be speaking about fever. Fever is caused a lot of concern in school-going children, and most of the parents are worried about fever. Fever is actually a protective mechanism which saves the children from infection. It is a defensive action of the body to get fever. So why are we worried about fever? Fever causes panic in children because sometimes fever can go up to 102, 103. And there is a difficulty to decide about whether it's a bacterial infection or a viral infection. Usually fever which goes above 103 is most of the 102 or 103 is viral infections, and most of the time it is symptomatic treatment. Parents insist on giving antibiotic for such fevers because the fever spike is about 102 or 103. But unfortunately, no antibiotics work on such fevers. So it is only symptomatic treatment for viral infections. If it is a bacterial infection, children get sick, and you need to give antibiotic because there will be continuous spikes of fever. Whereas in viral fever, the child will be active in between the fever. There can be multi-system involvement like running nose, gastroenteritis, vomiting, loose stools, all these things. So fever is the other reason why parents get panicked is fever. Sometimes high-grade fever triggers off a seizure. So seizure is one more thing which makes everybody panic in the house when the child throws a fever. But we have to remember there is an entity called as febrile seizure where we don't have to do anything actively for such fevers. Usually this febrile seizure occurs in children who have family history. We don't do any further investigations, but sometimes when they're present in a atypical form, we may have to do a scan or a EEG and decide about the course of the disease. So febrile seizures usually occurs between the age of 9 to 18 years, most common in between the age of 9 and 18 years. However, the age group is between 9 to 6 years. The commonest age of presentation is 9 to 18 months. And usually they throw a seizure, then they become little irritable, and they are fine within few minutes. If the seizure continues for longer duration, or if the fever comes when there is no spike of fever, or the spike of fever is less, then it is called as atypical seizures. These are the children who have atypical seizures are the children who are required to be looked into detail. So fever, to sum up everything, fever is a protective mechanism. Fever can be because of viral or bacterial. Viral fever does not require any antibiotic treatment. Symptomatic treatment of the viral fever is all that is required. And how do you differentiate viral fever from bacterial fever is most often when the fever stops, the child is playful, active. That gives you a clue that it is viral fever, and no antibiotic has no role in viral fever. Coming to febrile seizure, the seizure onset is between 9 to 6 months, and the most common period where it occurs is 9 to 18 months, and most often the treatment is symptomatic. Sometimes we can give midacept spray for patients who have recurrent febrile seizures.